Is that better?
Yeah, a lot better.
Is there any pain?
No.
Any pain?
Nope.
A lot of times, you know what? A lot of times we recover from the injury and it's healed. It's just neurologically. Now the big thing that's starting to come out is now, here's the kicker with everything that is done out there from me working with the trainers, the doctors, and everyone else, is at different levels. So we have no training, we've got mild exercise, moderate, high intensity. This is the training edge. This is where all the gains are made as far as firing off the type 2B fibers for strength and powerlifting, in bodybuilding. And this is the red line. This is tissue capacitance. If we have anyone here that, you know, basically races quarter mile, we know that you can go to the red line, but you can't stay there. You know, in powerlifting, we can go there. If you do heavy singles all the time, day after day after day, and not back it off, guess what? You're gonna get an injury. And you're gonna end up with basically what I call a mild injury. You usually drop the exercise. All of a sudden, you can't bench anymore. This is do-it-yourself rehab. This is where you start rolling around on a ball. This is, you know, you're starting to do some of the fascial stretching. You know, you're trying different things that you can do. If there's a bigger issue where it's the muscle, joint, and nerve, this is where you need treatment. This is where you know that something's going to work until it doesn't. So this is where I would probably come in. Any of you can do what this gentleman, what's your name? Michael. So with Michael, any of you can do that. It's not hard. It's within your scope. You're not doing anything really complicated. If I'm starting to go in here and start doing adjustments and everything else, that's within my scope. It's not out in yours. Surgery, that would be Dave. Dave would be in this area here. Can you manage it? Can you do it by some of the training stuff? Absolutely. And seeing Dr. Serrano and trying to basically mitigate a lot of that pain. But you know what? The end result a lot of times is surgery. So always keep that in mind that, you know, just because something doesn't work doesn't mean that you're doing the wrong thing. You're probably going to need to escalate it up to someone who's going to do something else. So for the treatment, there's a number of different techniques. This is one, active release. How many people here have seen or heard of active release? A lot of you. So Mike Leahy presented for me a number of times up at Swiss. And when you actually get active release done to you, it's, come on up. Do you have any issues? No, no issues, okay. So I was an assistant instructor for a number of years, and most people don't do active release properly. So when you do active release, this is how it's done. It's a tension technique. It's not a compression technique. So most people, when they're doing anything, they press down hard. You don't press down hard. If you get treated by Mike Leahy, it's not real painful. What you do is you take your hand and you twist it this way. So you're in here, in here. Now, not to say that you guys should be doing this. I'm just showing you the difference as far as what it actually should be. But I'm at tension. I'm trying to create tension through in here. So if I'm going to do some work on the wrist extensors here, and I have his wrist up, and I take the tension, and then what I do is I bring it down. You bring it down slowly, and I'm holding that position as I'm going through it. And in the last 10% of the movement is all the treatment, because I built up all the tension. There, it just started, and you can feel the tension there. Now, what a lot of people do is this, and you let me know if it's any different. That feels a little different, doesn't it?
Love it.
How many people heard that active release is super duper painful? It doesn't have to be. A lot of times, Eric put his hand up. It depends on who does it. So the whole trick is that you want to tension on it, not compression in that area. That's for the therapist. What size do you take? Large? Yeah. All right. There we go. Thank you. Let's keep going here. So we have the barbell bench press injury. So we got pec clavicular, pec sternal, and anterior deltoid. One of the things you can do is you can see whether or not there's any tightness when you're bringing the bar back. So one of the things that I do with a lot of the athletes and a lot of the powerlifters, I treat a lot of powerlifters, bodybuilders, they come in with bench press injuries. Very first thing, hand, wrist, and elbow and shoulder all in the same line, and then bring it back and just give it a try on yourself. See if that makes a difference there. Okay? Now, so that's normal. Your hand should basically be able to touch your chest as far as being in line, not as if you got a multiply shirt on you. This is another way, and this is another way that I test for also the fly. Anyone who has who has shoulder pain? Come on up. When you bench? Which shoulder?
This one.
What happened?
All kinds of stuff.
All kinds of stuff. Okay. Any surgeries?
Yes.
What did you have?
Anterior capsule surgery.
Anterior capsule surgery. When did you have that?
17 years ago.
And it still bothers you?
Yep.
Okay. So, this is what I do with anyone that's had surgery, anyone that's basically had any problems. I always start on the other side. Why? Number one, they might think that this is normal. It may not be. I want to have a reference point. So the very first thing that I'm going to do, and this is what you can do also, is the thumb is pointing up. And what you do is you bring it up, and the arm should touch close to the head. If I'm in this position here, and he's good in this stance too. Second one is this one here. The thumb is up, palm is forward, and what I want to see is whether or not he can bring his hand behind his shoulder. He can. Here, that's about as far as we can go. Is that painful?
Yeah.
Where is it painful?
Right there.
Right there. So this section right here.
Yep.
Okay. So there's a number of things that you can do for this. So this is what he looks like. He can't bring his arm back and it's painful. There's a strip all the way through his pec and also going into his shoulder. So this is just like we did some of the isometrics for the subscapularis. This is the same thing you can do here to see whether or not it will make a difference. It may or may not. Push into my hand. Push back. Push in my hand. A little less, a little less. Push back. You should do it about 50%. Push forward so you're not shaking. Push back. Push forward. There we go. Push back. Push forward. Push back. Now, do I need to do this? No, he can do it himself. So this may be a good warm-up for him when he's going to do bench or chest or anything else. Push forward. There we go. Push back. Good. Bring this down. Let's see if it made a difference. Is that better?
Yeah, a lot better.
Is there any pain?
No.
Any pain?
Nope.
A lot of times, you know what? A lot of times we recover from the injury and it's healed. It's just neurologically. Now the big thing that's starting to come out is brain-based treatment. If you've had an injury 6 months or longer, it changes the brain. And all of a sudden, because you perceive pain and also motion patterns inside here. So we're starting to use different technology of lights, of sound, and everything else, especially in concussions. I've gotten some new instrumentation where it actually changes the brain. I was in Las Vegas last year and they did some brain mapping on me, and I've been in enough car accidents and have concussions. So my memory isn't as good, so I'm starting to get my brain treated. But this makes a difference enough that it's actually better than the other shoulder. Now that strip that is gone, right?
Yeah.
A little freaky?
Yeah, very.
What size are you?
Large.
Large, all right. There we go, thank you. My whole goal is to try and empower the athlete as much as possible. the weight training athlete, the strength conditioning. Everyone is doing that anyways. They're rolling around and everything. They're starting to get Olympic barbells, throwing it in the corner and grinding the shit out of their bicep tendon, which doesn't necessarily work. But because certain people are out there saying, and especially within the CrossFit community where they're all rock taped, to all get out, and the mentality there is, and there's nothing wrong with CrossFit. I think it's a fantastic sport. A training methodology, not as good. There are better ways of doing it. But I mean, the whole aspect is, what is it that I can do? There's so many people that, what else can I do? If you can do these simple, this is about as Mickey Mouse as you can get. And that's really, really simple. Now you can advance it to actually even do it with motion and different aspects of it. But you're correct. And it's simple motions. It's not complicated. Can you bring your arm up? Actually, well, it'll be in the next one anyways. But can you bring your arm back in different rotations to see whether or not you have actually healthy enough shoulders in order to lift? And if you don't, can some of these little Mickey Mouse things work? Absolutely. And if they don't, you'll probably need treatment. And the treatments a lot of times don't take long. So for the actual muscle test, this is what you want to do. So I wrote a book in 2003 with Human Kinetics called Optimal Muscle Training. And in it, I created all these different muscle tests for the bench press. It was 8 muscle tests before you could do it. The problem is that I asked everyone, so are you using the tests? And everyone said no. I said, why? Well, there's too many tests. And I went, yeah, you're right. So I reduced it down to, I'm getting away from testing muscles, and I'm getting into, can I test the actual motion and the motion pattern of the exercise? So if I'm going to bench press, if I go like this and I bring it down, my starting point is here, my palm is down, my thumb is in, and my end point is here. And if I bring it out and extend the arm out, so basically the bench, if I wasn't going to bend my arm, would look like this. So this is different proprioceptively in the shoulder and also in the brain than if I was to do a fly. So we talked about the percussor. What does it actually do? There's a number of different things. This is out of all the research that I've seen, this is the mechanoreceptors that are in there. This tends to work on the Pacinian corpuscle. The Pacinian corpuscle is responsive to high velocity, so an adjustment on the actual muscle or vibratory techniques. And it can increase local proprioceptive attention. That's the first thing it does. The second thing it does is that after a while, the fascia that is covering all the different muscles and systems tends to thicken. It goes into a gel state. And when it's in a gel state, it doesn't move as much. The percussor tends to turn into a sol state or a water state. Fascia is about 90-95% water. So a lot of people that have tight fascia, you feel they're just underneath their skin. It almost feels leathery. The problem is it's dehydration that's going on. They're not getting enough water into the system. And Guy Voyer, who's one of the top osteopaths in the country, who I've spent some time with him in the cadaver lab, doing work and looking at fascia and all that, basically has stated that if someone is dehydrated, where you're actually feeling the differences in the actual tissues, it can take basically 4 to 6 weeks of drinking a lot of water to rehydrate. It's not drinking 3 cups of water and you're done. We're talking weeks here because there's so many different systems in the body that basically deplete out the water, aldosterone being one. So that's the challenge that you have. So it's a powerful tool. It's a great tool, but it's only a tool. So for the rehab, some of the aspects, I'm big into if you have pain when you're bench pressing, you can push into something and then you turn around and you just push backwards. And what that tends to do is fire up all the different muscles on either side. And if there's a proprioceptive or a neurological issue in the shoulder, which with chronic problems there tends to be, then this will be helpful. And if it doesn't work, then you know that you don't do that. A lot of times we recommend stretches and exercise and rehab, and we don't even realize whether or not it's actually even going to make a stick of difference. And this is a nice stretch that you can do. Instead of doing the classic, wall stretch where you're like this, and I'm going to stretch and get ready for the bench press when I'm doing like this, a better one is in this position here. Now, if someone is really tight through the pecs in this position, one that I tend to do is that I'm about 6-8 inches away from the wall, If this is 12 o'clock, I'm going to bring this down to about 1 o'clock here. I have my hand like this, and I'm just going to lean into the shower, or lean, you could do this in the shower where you just lean in and just have the hot water. The hot water will actually heat up the tissues, make it more pliable. And you can do that for about 15, 20 seconds as you stretch it out. The way you get out of that stretch, so if you're in this position here, is you don't drop your arm down in that. All you do is you just turn, bring your arm down, and you can go like that. So that's one way that you can actually stretch this out. And rehab, you can use tubing. So the weaker it is, the less tension that you start out with. The stronger it is, the further out that you can go. Do you know what the cool thing with isometrics is? The person can go to their capacity. And you become the weight resistance machine. So if they start out with 2 pounds, there's no weight machine out there that starts at 2 pounds. So if that's all that they can do, and they can bring it back, that would make a huge, huge difference. Now the other aspect of any post-surgical is a lot of times you have to treat the scar. And that's what this unit here is. This is the MPS Dolphin. So what this is needleless acupuncture. And what this does is that you can change the actual polarity to negative, positive, and biphasic. And I basically took some seminars a couple years ago with the people that created this. This is the most powerful tool that I've ever seen for scar and scar tissue. Like literally, I got cut here, and now I got this giant scar, whether it's keloided, it's red, or anything else. And if you treat it, it changes the actual polarity of it, and you can recover from that. Because a lot of times when the muscle is cut, neurologically, it still won't function as well. And the best testimonial I've ever seen, in 2015, Bill Kazmaier came out and he had knee surgery, and he couldn't walk properly. If you saw him in 2015, he was kind of limping. He was doing one of these as he was walking around. And we were like, what's going on? He says, yeah, I had knee surgery. So they went to the booth, the people that were presenting there, Dr. Bruce and Kelly Armstrong, and so they had Kaz there, and they treated his scar. So he jumped off the table, and then he ran down the hallway, and he said that was the first time he's been able to do that in 5 years. So simple little things. I could have active released that. I could have probably even lasered it, and it wouldn't have made any difference. This, for some reason, does make a difference. Does it work all the time? Absolutely not. But it can be very, very helpful. Again, the more tools that you have, and not that you need to do it. Like, I don't take x-rays. I send people out to get x-rays, to do MRI. Have people that's what their passion is, to sit in a dark room and read all these things all day. That would drive me nuts. Certain people that are antisocial, they love doing that. Pain with pushing overhead.